The COVID pandemic has raised so many questions about HIPAA. Does it violate HIPAA for me to be asked if I'm vaccinated? Does it violate HIPAA for me to be told to wear a mask? These are all sorts of questions we've been asked. I'm Erin Jackson with Jackson LLP Healthcare Lawyers, and we do a lot of work regarding HIPAA. So HIPAA is a federal law that was passed by Congress a couple decades ago. The purpose is to ensure that patients can tell their secrets to their doctor and that their doctor cannot tell that information to anyone else. So HIPAA only governs the conduct or applies to doctors, insurance companies, or the billing company that your doctor hires to collect their bills. It doesn't apply to the library or to a restaurant or something like that. So if you disclosed a dietary restriction to a restaurant or you checked out several books on depression at the library, those are not things that are protected by HIPAA, even though they might relate to your health. So those who are covered by HIPAA are called covered entities. So there's going to be a distinction between how covered entities and other businesses are treated. One question we hear: does it violate HIPAA to ask if someone has been vaccinated? No, asking questions does not violate HIPAA. If you're asked and you don't want to answer, you don't have to. However, keep in mind that might have consequences, like you might not be allowed to enter a business like a restaurant. One thing that HIPAA would prohibit is if your doctor were asked whether you had been vaccinated by your employer, and without your permission, your doctor went ahead and sent over your medical record and said, here, you can see for yourself, they've been vaccinated. If you haven't authorized that, that would be a breach of HIPAA, and that would be a breach of your protected health information, which would be shared by a covered entity, your doctor, with someone to whom you didn't authorize release. That's really the only way HIPAA would play out in this whole discussion. I've also been asked if it violates HIPAA for a business to require their employees to get vaccinated. The answer to this is really no. HIPAA has nothing to do with this, and employers are typically allowed to make decisions under the law based on what they think is in the best interest of their employees' health and safety. So if they think that means vaccination, then that's what they're allowed to do. Again, this isn't a HIPAA question. Can I require my staff to wear masks? The answer is yes. Especially as more variants emerge, you absolutely can require your staff to wear masks. Mask mandates have been lifted, but a mandate is different when levied by the government than when you make it a condition of employment, especially if you think it's what's best for your employees. Another question we hear: can I require my patients to wear masks in my clinic or in my practice? Absolutely, especially for practices who treat vulnerable populations who maybe weren't able to get vaccinated, or populations like pregnant women who have been given more leeway and discretion by health authorities to make those decisions themselves. It might be really wise to require masking. It also protects those who are unable to get vaccinated from being required to seek alternative accommodations, such as coming in after hours to receive physical therapy or seeing a doctor at a different location to avoid encountering a particular urgent care center in your hospital. If you didn't require masking and you had a patient who was unable to get vaccinated due to a disability, then you would have to make an accommodation. So one of the recommendations I have is frequently to just continue to require masking, and then the accommodation is that anyone whose disability prevented them from getting vaccinated is automatically accommodated because everyone is still masking, which is what everyone was doing before there was a vaccine. As always, if you have questions about running your practice in ways that are compliant with HIPAA and safe for your patients and your staff, then you can always reach out to us if we're in one of the states in which you operate. For more tips about how your practice can stay compliant, subscribe to our YouTube channel.